Welcome back to Health for You. Today we're taking a deep dive into a topic that, well, it gets a lot of buzz in health and wellness circles. Intermittent fasting, or IF as you often hear it called.
That's right.
And you, our listener, you've sent in a really fantastic range of sources. Healthline, Frontiers, info from Mass General Brigham, the Mayo Clinic, WebMD, and even a specific journal article looking at IF for diabetes.
Yeah, a great collection.
So our mission today is to really unpack all this information. We want to understand what these sources are telling us about intermittent fasting, what it actually is, how it might impact your health, and maybe most importantly, what the science really says.
Exactly. And we've got a lot to work with here. It covers quite a bit of ground, doesn't it? From clearing up some common myths.
Oh yeah, the myths.
To exploring potential effects on, say, your heart health and its role in managing conditions like diabetes and obesity, which are obviously huge topics. So we'll look at the different ways people do IF, the potential upsides like weight loss or maybe better metabolic health, but also, crucially, the cautions and, what we don't fully know yet.
Okay, let's get right to it then. For anyone maybe just hearing about this, what exactly is intermittent fasting in simple terms?
Well, basically, intermittent fasting isn't really about what specific foods you eat. It's much more about when you eat them.
Okay.
It's an eating pattern where you intentionally cycle between periods of eating and periods of, voluntary fasting. And this happens on a regular schedule.
So the focus is on timing rather than like carbs or fats.
Precisely. Instead of zeroing in on food groups, you're structuring your day or maybe your week around these set times for eating and not eating.
And as we saw in the sources, it's not just one single method, is it? There seem to be quite a few popular ways people practice this.
Oh, absolutely. Our sources definitely highlight a few main approaches. Probably one of the most talked about is time-restricted eating, or TRE.
TRE.
Yeah. And that involves picking a specific window of hours each day to eat, and then you fast for the rest of the hours.
Like the 168 method? I feel like I hear about that one all the time.
That's the classic example, yeah. A 16-hour fast followed by an 8-hour window where you eat your meals. The sources also mention maybe a slightly less intense 12-hour overnight fast.
Okay, 168 seems to be the poster child. What other variations did the sources mention?
Well, there's also alternate day fasting, ADF.
Alternate day, so like one day on, one day off?
Kind of. It usually means alternating between a day where you eat very little. Some sources say maybe around 25% of your usual calories.
Wow, okay.
And then a day where you eat normally. Then you've got modified fasting. And the 5.2 diet is often given as an example.
5.2, so 5 days normal, 2 days restricted.
Exactly. Eating normally 5 days a week, and then on 2 days that aren't consecutive, you really cut back calories, maybe to around 500 or 600. And finally, the sources also mention Ramadan fasting, which is, of course, different as it's for religious reasons, complete abstinence from all food and drink from sunrise to sunset.
Right, so quite a range of approaches, but all based on that core idea of cycling, eating, and fasting. Now, IF comes with a lot of claims, a lot of beliefs. What about the myths? What did our sources help clear up?
Yeah, this is really important. One myth you hear a lot is that IF causes you to lose tons of muscle mass.
I've heard that one.
But the research suggests that's not quite right. A big analysis from 2022, a meta-analysis, basically found that people lose a pretty similar amount of lean muscle, whether they're doing IF or just standard daily calorie restriction.
Oh, interesting. How much?
It was around 25% lean mass loss in both groups, with most of the weight loss, about 75%, coming from fat. So IF doesn't seem uniquely bad for muscle compared to other diets based on that analysis.
Okay, that's good to know for people worried about muscle. What about the idea that IF is like this guaranteed path to long-term weight loss? That's another big claim.
Yeah, the evidence there is, it's still developing, you could say. There is one study mentioned that followed people for a whole year.
Right.
It found that while time-restricted eating did lead to more weight loss at first compared to a control group, over the full year, it wasn't actually more effective than just cutting calories consistently every day, especially in a diverse group.
So it helps, but maybe not more than just eating less overall.
That seems to be a recurring theme, yes. While IF can be a tool for weight loss, a lot of that benefit might just come down to the fact that you end up eating fewer calories because your eating window is shorter.
That makes sense.
So focusing on that overall calorie balance might be just as important, if not more so, than when you eat.
Were there other common misconceptions addressed? Maybe about health risks?
Yes, the Healthline article touched on some myths about negative impacts on, say, sex hormones or fertility, or the idea that IF automatically leads to unhealthy eating habits or even eating disorders.
Yeah.
But the key takeaway there was that the research looking specifically at those things is still pretty limited. We need more studies, really.
So not enough evidence to confirm or fully debunk those yet.
Pretty much. And they also tackled the myth about skipping breakfast being inherently bad. The sources suggest that if the rest of your day's food intake is healthy and balanced, skipping breakfast isn't necessarily harmful.
Okay. And exercise. Can you work out while fasting?
Generally, yes. The consensus seems to be that fasted workouts are usually okay, although you might feel a bit more tired, especially at first.
Right, so it sounds like a lot of the common wisdom floating around about IF maybe doesn't perfectly match the science we have so far.
Yeah.
Let's flip to the positive side then. What potential benefits did the research in our sources highlight?
Okay, yeah. Probably the most common benefit people talk about, and one that has decent research backing, is weight loss.
Right, the calorie thing we mentioned.
Exactly. A big part of it is often just eating fewer calories because you have less time to eat. But there's also the idea that IF might affect your hormones in ways that encourage fat burning.
How so?
Well, it can lower insulin levels. Insulin helps store fat, so lower levels can signal your body to burn stored fat instead. It might also increase human growth hormone, HGH, and boost norepinephrine, which is involved in fat metabolism too.
And do the studies show this works?
Studies have shown weight loss anywhere from, say, 0.8% up to maybe 13% in people who are overweight or have obesity. But it's important to remember a lot of these studies were pretty short-term.
13% is significant, but short-term is key. What about effects beyond weight, like metabolic health?
That's another area where IF looks promising. Several sources link it to improvements in things like lipid profiles or cholesterol and triglycerides, better insulin sensitivity, meaning your body responds better to insulin, and just generally better control over blood sugar.
Any specifics on conditions like diabetes?
Yeah, some studies, specifically in people with type 2 diabetes, showed lower fasting blood sugar and reduced insulin resistance with IF. And one meta-analysis suggested IF might give similar blood sugar control to regular calorie cutting, but potentially more weight loss.
Interesting. And what about the heart? That's always a big concern. How does IF stack up for cardiovascular health?
This is where things get a bit more, let's say, complicated, and we need to be careful here.
Okay.
On the one hand, some research does suggest IF might help reduce certain heart disease risk factors, like lowering inflammation markers, blood sugar, triglycerides, and that bad LDL cholesterol.
That sounds good.
Right. Some studies even showed improvements in both LDL and HDL, the good cholesterol, with alternate day fasting. But, and this is a significant but, there was a preliminary analysis. This was data from a large U.S. health survey called NHENES, presented just this year, 2024, at an American Heart Association conference. And it raised a pretty big red flag.
What did it find?
It suggested a potential increased risk of death from cardiovascular disease for people following an 8-hour eating window.
Increased risk with the 8-hour window. Wow.
Yeah, particularly in people who already had heart disease. It was preliminary, needs more research, but it was definitely a surprising finding.
That is surprising. So the length of the eating window might matter more than we thought, maybe even negatively.
It suggests that, yeah, it really highlights that we desperately need more long-term human studies to figure out what's truly going on with IF and heart health. It's not straightforward.
Definitely something to watch.
Yeah.
Okay, besides weight, metabolism, and this complicated heart picture, any other potential benefits mentioned?
There's some interesting, though, often early-stage research on brain health. Animal studies suggest IF might improve thinking skills and maybe even help grow new brain cells in the hippocampus, which is key for memory.
In animals, though?
In animals, yes. Needs more human data. Also, because IF structures, when you eat, it can influence your circadian rhythm, your body's internal clock.
Ah, the sleep-wake cycle connection.
Exactly, and keeping that rhythm aligned is important for overall health. Eating at odd times could potentially disrupt it, which might contribute to metabolic problems down the line.
Anything else?
Some other potential areas mentioned were effects on inflammation, maybe positive changes in your gut bacteria, increasing the good kinds, and even impacting markers related to aging, like triggering cellular cleanup processes known as autophagy, or affecting certain longevity genes, at least in short-term studies.
Okay.
And because of its effects on metabolism and immunity, IF is even being looked at for potential roles in things like cancer or maybe how people fare with infections like COVID-19. But again, much of that is still exploratory.
Right. Lots of potential avenues, but many still need a lot more investigation, especially in people over the long run. Which brings us neatly to the other side, the concerns and cautions. What are the potential downsides or risks the sources pointed out?
Well, the biggest one, as we just discussed, is that question mark around cardiovascular health.
Yeah, that NA-NEAS data is sobering. It really is. The Frontiers article stressed how few long-term studies we have, and then this finding comes along. Plus, some animal studies also showed heart issues with long-term alternate day fasting, so caution is definitely warranted there.
Okay.
Another potential issue is compromised food quality.
How so?
The idea is that if you only have a short window to eat, you might be more tempted to go for, really satisfying, rewarding foods that might not be the most nutritious.
Like comfort food overdrive during the eating window.
Kind of, which could mean less fiber, maybe more sugar or unhealthy fats. And that could even play into why some IF studies actually saw LDL cholesterol go up.
Ah, interesting connection. So focusing only on when could make people less careful about what.
It's a possibility, yeah. Then there's the loss of lean mass. Like I said earlier, it might be similar to calorie restriction, but losing muscle is still generally not ideal, especially for overall health and potentially for heart health too.
Still a factor to consider. Definitely. Also, circadian misalignment. If your eating window pushes meals late into the evening, it could mess with your body clock, and that's linked to risks for chronic diseases over time.
Right, eating late isn't usually recommended.
And hormonal effects. While some studies didn't find major issues with sex hormones, the research really isn't robust enough yet, especially for long-term effects in both men and women. We need bigger, longer studies.
Seems like a common theme. Need more long-term data.
It really is. And, crucially, individual variability. How IF affects someone can really vary based on their age, their sex, their overall health status. It's not the same for everyone.
Which implies it's not for everyone. Are there specific groups who should probably steer clear?
Yes, the sources were pretty clear on this. Generally, IF is not recommended for teenagers, for women who are pregnant or breastfeeding, anyone who's underweight, or individuals with a history of eating disorders. It also might not be suitable for older adults at higher risk of bone loss or falls. And this is critical. Anyone with diabetes, especially if they're on medication, absolutely must talk to their doctor first.
Why specifically for diabetes?
Because of the risk of hypoglycemia, blood sugar dropping too low, which can be dangerous. ET can significantly impact blood sugar control.
Very important warning. Okay, so how does IF stack up against other strategies people use for weight or health?
Well, a key point made in many studies is that a lot of the benefits seen with IF, the weight loss, the metabolic improvements, might just boil down to eating fewer calories overall.
So the magic might just be calorie reduction, not the timing itself.
It's quite possible that's a large part of it for many people. And interestingly, the Frontiers article brought up the rise of obesity pharmacotherapy medications like GLP-1 agonists.
Yeah, those are getting a lot of attention.
Right, and they've shown really significant weight loss, often more than typical IF results, maybe with less muscle loss, and you don't have to change when you eat.
So potentially more effective for some.
It's looking that way. The idea is emerging that maybe the best approach for managing obesity and heart risk might be a combination of these newer medications plus lifestyle changes, like a healthy diet, maybe Mediterranean style, and regular exercise.
A more comprehensive approach.
Exactly. It seems like the whole field is evolving quite rapidly.
It certainly does. Okay, so for someone listening who is still curious about intermittent fasting, maybe wants to try it, what practical advice can we pull from these sources?
Number one, absolutely top of the list, echoed everywhere. Talk to your doctor or healthcare provider first. Seriously. Especially if you have any health conditions or take medications.
Non-negotiable first step.
Absolutely. Then, if you get the green light and want to proceed, a gradual start is usually best. Maybe begin with a less intense time-restricted window, like 12 hours fasting overnight, and see how you feel.
Start slow. Ease into it.
Right. You can gradually shorten the eating window if it feels right for you. And maybe the most important practical tip, alongside talking to your doctor, is focus on eating a healthy, balanced diet during your eating window. EDF is not a pass to eat junk food when you are eating. Nutrient quality still matters a lot.
Good point. the what is still crucial, even if you're managing the when.
Precisely.
Okay, let's try and synthesize this as we wrap up. What are the main takeaways from this deep dive into intermittent fasting based on all the info you shared with us?
Well, I think what we've seen is that EF is definitely a fascinating area. There's active research, and it does show potential benefits, especially short-term, for things like weight loss and some metabolic markers. But the long-term picture, particularly for heart health, is much less clear and frankly has some emerging concerns that need serious attention and more research. It's not a guaranteed win, and it's definitely not a magic bullet.
And here's what I found really interesting. That growing suggestion that maybe, just maybe, a lot of the benefit comes down to simply eating fewer calories.
Right. That calorie deficit aspect seems key.
Which makes you think, is the timing the special part? Or is it just a tool that helps some people eat less overall? And with these new medical options showing strong results.
The whole landscape for managing weight and metabolic health is definitely shifting, yeah? There are more tools in the toolbox now.
So what does this all mean for you, our listener? If intermittent fasting has caught your interest, the big takeaway is approach it with open eyes. Be informed.
Definitely. Think about your own health, your lifestyle. Have that crucial conversation with your healthcare professional.
Yeah.
And remember that sustainable habits, a generally healthy diet you can stick with, regular movement, managing stress, getting enough sleep, those are still the foundations for long-term health, regardless of whether you choose to try IF or not.
Couldn't agree more. This deep dive hopefully has given you a clearer, more nuanced picture of intermittent fasting, drawing from all those sources you provided. If you found this helpful, we really encourage you to check out other discussions here on the Health for You channel. We cover a lot of health and wellness topics.
That's right. And if you have more questions on IF or maybe another topic you'd like us to dig into for a future deep dive, please do let us know.
Yeah, we're always ready to dive deep and bring you the most important bits of knowledge we can find to help you on your health journey. Thanks for joining us.